Yeah, thank you, everybody. My name's Iain Bestford. I'm Project Director with Newcastle Improvement. As Kath said, I've been working on continuous quality improvement at Newcastle Hospitals for the last 3 years. I thought it would be really helpful just to start with a little bit about the organisation. Newcastle Hospital has been one of the busiest, largest and most successful teaching foundation trusts in the country. We've got about 16,000 staff, annual income of about 1 billion. And we're predominantly located across 2 main hospital sites in the city, Newcastle upon Tyne, the Royal Victoria Infirmary, which has our major trauma centre, ED department, and our Great North Children's Hospital linked to that site. And then our Freeman Hospital, which hosts our Northern Centre for Cancer Care, our Institute for Transplantation, and our recently opened Day Treatment Centre. We've been rated outstanding by the Care Quality Commission for the second consecutive time in 2019, and we continue to provide high quality care, clinical excellence and innovation and medical research regionally, nationally and internationally. We continue to provide specialist services across the country as well, the range of rare and complex medical, surgical, neurological conditions, cancers, genetic disorders. And so probably fair to say that QI and sustainability have been natural bedfellows in Newcastle hospitals under the banner of Flourish, which is, I guess, our organisational development programme within Newcastle hospitals. The 2 key strands, alongside learning, celebrating diversity, staying well, and being valued and heard. And I guess importantly, in June 2019, we were the first healthcare organisation in the world to declare a climate change emergency, and we subsequently, in October 2020, published our climate emergency strategy. So I guess really, what was our problem? Because we felt as though we were in a decent spot as an organisation. We were committed to delivering on the climate change plan. So why do we need to do anything else? Well, the problem for us was that there was a lack of evidence that our quality improvement projects were having a material impact on the Trust's ambition to deliver zero carbon care. And I guess using the kind of model for improvement, we then thought, well, what would our aim be around that? What would we want to do about it? So we've set ourselves an aim to increase the proportion of QI projects that have sustainability metrics reported to 20% by March 2024. Essentially from a baseline of 0. We can have a debate as to whether that's ambitious enough or not, but it's where we've landed. And I guess we thought about some of the key drivers that sit behind that. So an awareness and desire, and I think it's fair to say that our Sustainable Healthcare in Newcastle team, our SHINE team, have already, identified green champions across the organisation. So the desire to deliver on this agenda is there. Awareness with regard to it within, I guess, the realms of QI, maybe less so. And I guess importantly, that capability, confidence, and I'll come on to that. Capacity continues to be a challenge in delivery of improvement initiatives in general, not just those linked with sustainability. So what did we do? Well, I guess we've decided to focus on the capability and confidence piece. We wanted to show fidelity to the model for improvement. We've been working with the Institute for Healthcare Improvement for about 2 years now, and we recognised that fidelity to a model was really important. It didn't really matter which, but we decided in Newcastle hospitals to adopt the model for improvement. So we wanted to retain that at the core of what we did. We didn't want SusQI to be seen as something particularly different. We wanted it to be part of everything that we do in Newcastle. We wanted it to be mainstream. We didn't want to be a niche. We didn't want people going up and saying, well, we're SusQI and everybody else is QI. And we recognised the talents that existed within the existing teams of Newcastle Improvement and Sustainable Healthcare in Newcastle. And we wanted to maximise the resources that we had. So what did we do about it? Well, we've brought our QI training in-house. We had been relying heavily on IHI to do some of that delivery for us. We've now brought that in-house, and we're delivering that through Newcastle Improvement faculty. And that provided us an opportunity to review the materials with Centre for Sustainable Healthcare. And I guess what we've undertaken is a series of incremental and rapid adoption. We only really engaged formally with CSH in around December. So it's been quite a rapid turnaround in order to get materials prepared. And we've had a number of our coaches attend the CSH workshops. So what have we done differently? I guess there should have been some animations on this, but it won't show in this, I guess, in the way that this is shown. But we originally in our materials had the Institute of Medicine definition of quality improvement, so they've been safe, effective, patient-centered, timely, efficient, and equitable. And following kind of the review of the materials, we've changed to embed sustainability as part of what we've done. So we're moving towards that Royal College of Physicians definition with sustainability as a cross-cutting quality domain. The other things that we've done with regards to the content that we are delivering is we've really looked at how we discuss and bring into focus measurement. So we have traditionally focused on quality, patient safety and experience, staff experience, performance, productivity, efficiency, and financial stability. So 4 key elements. But more recently, and in our latest training program, we've further adapted that and broadened the scope of measurement to specifically, explicitly discuss environmental sustainability as a key domain. And some of the examples that we've given in there, it's a number of miles traveled by community team visits, or reduction in carbon footprint as a result of reduced length of stay and being able to reduce overall bed capacity. We further added in health inequalities, recognising that as a key component of delivering on QI as well. So we've taken the opportunity not just to build in sustainability and then to work through SusQI and CSH, but also to look at those other factors that are really important to us as an organisation. And with support of CSH, we've also looked at embedding other aspects of and improving on other aspects of our training by including things such as the social determinants of health. I guess there might not immediately be apparent that it's sustainability, but they're important considerations nonetheless. And I guess just to finish with a couple of comments that I've received from some of our faculty, so a couple of the guys who work in our team in Newcastle Improvement. So Chris Ellis, who's one of our quality improvement program managers. Chris said that when we were given an example of a project, we're bringing in the sustainability of domain of measurement, even if that wasn't the primary focus of the project. For example, the project focusing on reducing length of stay is now also linked to a potential reduction in our carbon footprint. And Sarah Watts, one of our improvement facilitators who attended one of the SusQI workshops, has really grabbed this and then running with it. You know, she says, when I'm coaching the team, feel able to highlight potential sustainability metrics. And I think the confidence that the faculty have gained through the engagement with the Centre for Sustainable Healthcare, being able to introduce some of these concepts and share with the teams with which we're working has been really important.